Welcome back to the ACS Brief from the Frontline Surgeons' Voices. With me today is Dr. Maie St. John. Dr. St. John is the chair of head and neck surgery at UCLA, and in addition is here today in her role as the Board of Governors Member Services Pillar Lead. Welcome, Dr. St. John.
Thank you so much, Dr. Wexner. It's my privilege and pleasure to be here with you today.
Well, it's great to have you here because member services is the lifeblood, of course, of our roughly 85,000 members and fellows of the college. Perhaps you could start out telling us what are some of the initiatives from your pillar this year under your lead?
So thank you so much. I'm really excited about this opportunity because I still recall when I was finishing up my residency and becoming a member of the American College of Surgeons as a subspecialty member in otolaryngology and head and neck surgery. I remember my interview vividly because to me, it felt like it was a rite of passage and becoming part of this wonderful, dynamic, supportive, innovative group of people who want to improve, standardize, and make surgery the best all around the globe. So for me, it's been a lifelong passion, and I graduated back in 2006, so about 16 years ago, that this has been important to me. Very, very near and dear to my heart here in the member services pillar is the fact that we get the opportunity to excite everyone about becoming a member of the college. And so much of what we do is really to enhance and encourage membership and support all around the globe. We have 3 work groups in our member services pillar. And the first of these is the Surgical Volunteerism and Humanitarian Awards work group, which is the work group that I was working in prior to this role. And one of the things that's really important about this work group is that it is just so humbling to be a member of the group, because what you have the opportunity to do, what you get to do, is take a look at what people are doing in terms of deep service for the college here as residents nationally and internationally, and with teams of people, and not just with surgery, but with education and collaboration and research efforts. So this year, we've been very fortunate to have the leadership of Dr. Daniel Boone and Dr. Manoj Manga. And a lot of what we've been working on is thinking about which individuals have really contributed deeply in order to award them and allow others to see the opportunities and possibilities that can happen when people can be of service. So this year, the work group reviewed about 23 nominations for individuals to receive the Pfizer awards for surgical volunteerism. And we're very, very happy to highlight. It'll come out in the bulletin, and the awards will be given at the Congress meeting. Individuals for their domestic surgical volunteerism, resident surgical volunteerism, academic global surgeons, international surgical volunteerism, and surgical humanitarian efforts. So this has been outstanding, and we are also looking into ways to enhance further awards in other areas for those who are deeply committed to moving the needle forward for patients all around the world. Our second work group is our domestic work group, and this has really been a very strong workhorse group to enhance membership nationally and to enhance initiatives nationally. And we've had really wonderful leadership from both Dr. Livornia and Dr. Swallow. And here in this work group this year, we've really kind of tried to focus on chapter recruitment grants. We want these grants to help enhance each chapter. And we've also worked on enhancing chapters that need some more support and opportunities for growth with chapters that have been able to build a lot of what we wanted to accomplish this year. We also have set up a virtual programming for the chapters initiative to increase the Division of Education's CME and working closely and collaboratively with them. In the ACS brief, we have been communicating the value of the chapters and the value of membership to those looking forward to joining. Most recently, there was the 70th anniversary of the Louisiana chapter and also the South Dakota chapter that were highlighted. And so each of the chapters are now also coming up with new logos to personalize and allow them to have member input on what they would like to be representing. And finally, we have our international work group, and I really want to give a big shout out to them because whenever we have virtual meetings, people have set their alarms for 2 and 3 in the morning to be on these meetings because it's so important. And that's really heartwarming to all of us, people all around the globe. So each of the international chapters have now finalized a database of observerships and visiting fellowship opportunities so we can have cross-training and collaboration. We also continue in that work group to have the wonderful leadership of Dr. Hiba Abdulaziz and Dr. Nora Horo. Within the work group, there are 3 subgroups. The first is the Build a Chapter subgroup, where the mentor members in countries where there's potential to form chapters, mentor new countries that want to join. There's an International Chapter Promotion subgroup, where we're working on getting consistent articles and communications and educational materials in the ACS publications, highlighting the achievements in each of the international sites. And the final group is the engagement and outreach subgroup, where we are having them engage with assigned chapters throughout the year to provide mentorship and assistance to leaders in developing groups. One of the main goals is to standardize and globalize the practice of surgery through international collaboration and advocacy. So that is really a summary of what we've been doing in the work groups, Dr. Wexner, and we're really thrilled and excited about the opportunities.
That is a phenomenal amount of work that's being done. And clearly the work group members are engaged if they're setting alarms for 2 and 3 in the morning and helping nurture along new potential prospective chapters. So my hat is off to you for all the work you're doing. And I'm sure under your leadership, working along with Dr. Sutherland and member services, that we're going to have another bumper crop of initiates in 2022 live, and again, of course, in 2023. Greatly appreciate all you're doing. Please, any additional comments?
Yes, I just wanted to mention with Dr. Sutherland, one of the great initiatives that we've been working on with Emily and the team is that we now have looked at enhancing resident membership. And even within our subspecialty, thanks to Dr. Sutherland, he's going to be presenting live at the Society of University Otolaryngologists as to how we can enhance resident membership. And one of the wonderful things that the college has done is they provided us with information on how we can sign residents up as a block. So here at UCLA, I have emailed all of the surgical chairs and program directors, and we are now just signing the residents up en bloc to the college so they can kind of start really understanding and feeling what it means to be a member of the college. And Dr. Sutherland has really kind of pushed this initiative, and now we've sent it to chairs all around the country and program directors. So we really hope to get membership at the resident level that will then translate into robust membership and engagement beyond. I really just want to highlight that the feeling from me and the feeling from everyone in our pillar is that the college is really the strongest voice for all surgeons across all specialties. We advocate for positions and issues that affect and benefit the surgeons of all specialties and the surgeons of tomorrow that we continue to train. And that the college really leads the way in programs that support patient-centric care, research, whether it be basic research, translational, or quality, health policy, continuing education, networking opportunities, and that we have strength and diversity. We have so much to offer all surgeons and all specialties at any point in their careers from very diverse and global backgrounds. So it's really a pleasure and privilege to serve in this role. I thank you, Dr. Wexner, for your time, and I thank everyone for the opportunity to serve.
Outstanding. Certainly the residents are the lifeblood of the future of the college. So thanks again for everything you're doing. Thanks for your time today, and looking forward to seeing the fruits of your labors, which I know will be impressive.